Okay, thank you for joining me, Doctor. Please tell your name and
Thank you.
the
My
country.
name is Sosthenes Bagumhe, the General Secretary of the Pan-African Health Informatics Association, in short it's called HERINA, and also the President of the Tanzania Health Informatics Association, in short it's called TAHIA, and also the Principal ICT Officer of the Ministry of Health in Tanzania. I'm based in Tanzania. Thank you very much, my moderator. Over to you. Thank you.
Thank you for joining me again. Okay, given the diverse challenges faced across the continent, such as limited infrastructure, funding constraints, and workforce shortage, how do you envision leveraging digital health technologies to ensure equitable access to quality health care for the people in the continent?
Thank you very much, my moderator. The future of digital health is global evolution. Our planet is in a turning point whereby digital health is no longer a luxury, rather it is a necessity. As we navigate through the challenge of maternal mortality, aging population, rising chronic disease, and healthcare accessibility, digital health is emerging as a great equalizer. The funding cut is a really challenge across the globe, but it's an opportunity for different digital health stakeholders to collaborate with the multilateral organization and to bring the shining light at the end of the tunnel. The question is no longer if the digital health will transform the health sector, but rather it's how fast can we scale up innovations and bring efficiency in healthcare delivery and save lives and make this world a better place. Mm-hmm. The time to innovate, invest and collaborate is now, since the future of health is digital. Thank you.
Great. What specific strategies or policies are being prioritized to foster the development of self-reliant digital health platform in Africa, and how can the continent mitigate risks related to data security, interoperability, and digital literacy?
Thank you very much. First of all, I congratulate you for a very good question. It's a very good and critical question. At this time, I think we needed to deploy and embark on building local communities, imparting them with global standards, knowledge and skills to make sure that we deploy a very effective and efficient digital health strategies, and also adapt global interoperability standards to fit our local needs. Standards like the WHO Smart Guidelines, they are very good standards to deploy, with they assure they translate from level 1, translating the policy and guidelines, and level 2 coming up with digital adaptation kits, the DACs, and level 3 you come to the machine readable, level 4 to level 5, which they ensure this system they can support artificial intelligence and emerging technologies. And the last level, which is level 5, they can also ensure that they can also deploy data analysis to make sure that we come up with the informed intelligent reports and visualizations and charts and graphs, which they can make a good data-driven decision making for the high-level decision makers. This is very good to adapt these standards, and also deploying and adapting like the FHIR standard, fast health integrated standards, and also the HO7 standard, which is also the synonym of FHIR, to make sure that our systems are FHIR compliant. HERINA, in collaboration with the FHIR Global, they're adapting, and the multilateral organizations, they're adapting to deploy and embark in making the African FHIR. So this such a kind of initiative, they'll be embarked in being deep dived in the HERINA conference as a back-to-back, one of the side meetings of the back-to-back conference of HERINA conference, which will be held in August from 24 to 28 in Gaborone, Botswana this year. And also we benefited a lot from the training of the local African local skills ICT experts on the open digital health summit in 2024, which was held in Kenya last year, whereby we brought gurus of digital health across the globe in collaboration with multilateral organizations and development partners and IPs to make sure that we train our experts across the globe and share the knowledges, because with the synergy of knowledges, create a room for repository of skills and knowledge across the globe, which can support African countries to make sure that they evolve from being ad hoc to organize the state of digital health development and coming to integrated digital health development. That's the way to go. Thank you very much.
Great. Considering the potential of digital systems to transform healthcare delivery, what role do regional collaborations and partnerships such as the Africa CDC play in accelerating the adoption of innovative health technologies across the African countries?
Thank you very much. That's a very critical question. Very good. Thank you very much for that very good question. The Africa CDC is a regional body whereby it can facilitate coordination of the African countries and making them to come to speak as a voice as one continent. So coming with strategies like the data governance strategies, digital transformation strategies, which are regional at the regional level, emerging technology strategies like the artificial intelligence policy of the Africa. It's a very good way to go. Apart from that, also coming up with the digital economy strategies and policies to prepare and pave a way, the direction for the continent, for the individual African countries to follow and to build on the existing blocks which the Africa CDC is playing. Apart from that, coming up with the pandemic and epidemic readiness, Africa CDC is playing a very pivotal role in making sure that they create the frontliner health workers and frontliner digital health stakeholders to make sure they respond to the epidemic and pandemic disease across the country, so that they can control the cross-border outbreak of disease, including the participating countries which are nearby. So Africa CDC can play in organizing the individual African countries, making them to come as one, and also facilitating the control of disease, or outbreak of disease like such as pandemic and epidemics, and responding, making sure that they offer the early response to this outbreak of disease, and making sure that Africa become a better place for the not only for Africans but also for other global citizens. The question is not how can we do it, but is how fast can we do it to make sure that we make Africa a better place for Australia, USA, and Europeans in the other continent. Thank you very much.
Thank you. WHO Director General Dr. Tedros Adhanom Ghebreyesus recently stated that cuts to health aid are an opportunity to shake off the yoke of aid dependency and embrace a new area of sovereignty, self-reliance, and solidarity. In this regard, what's the importance of establishing local vaccine manufacturing capacities, and what are the key priorities to ensure vaccine security and self-reliance in the continent?
Thank you. That's a very brilliant statement offered by the Director General of WHO. I think it's a very good direction whereby African continent should really, it's a time to wake up. It's a wake-up call for the African continent, actually, to come up with a mechanism and strategies to ensure we come up with sovereignty of Africa, to make sure that we are self-reliant in vaccine manufacturing, and also other mechanisms to control the pandemic and epidemics in Africa. Actually, the way it is, the situation is that we are experiencing a funding cut, and the deploying manufacturing industry is capital intensive, but it's a time to collaborate with investors across the globe to come in Africa and build the industry for vaccine manufacturing and circulate and trade in a cost-efficient and benefit-driven in Africa, solutions, vaccines in Africa. Actually, this is the way to go because we experienced during the COVID era, Africa, we were really struggling to get vaccines while people were dying out of before having vaccines. So it's a wake-up call for Africa and the globe and the investors to come in Africa and invest in these industry manufacturing vaccines. Actually, the African country and through the African Union, they can prepare the policies which are friendly for investors to invest in Tanzania, in Africa, so that it's a conducive environment for investors to deploy their industries and making sure that the business is thriving in a very profitable way so that investors can really see the way and the need to come in Africa and invest for the betterment not only of Africa but also the entire globe, because disease cross borders faster than human cross. Thank you very much.
Okay. How can South-South cooperation promote the development of medical technologies, in particular the use of AI, to achieve true medical sovereignty for countries in the continent?
Thank you very much. AI is moving with a very high speed. I can quote one of the inventors of a supercomputer and GPU across the world. It's called NVIDIA. NVIDIA said, between this year 2025 to 2030, we'll experience the tsunami of innovation of artificial intelligence and emerging technologies. So I think they play a very pivotal role in medicine and vaccine inventions in such a way that we can move with a very high speed rather than compared with the other eras which have passed. So they play a pivotal role in bringing this world in a very high speed of invention, but also service delivery using technology as an enabler to bring efficiency in healthcare delivery. AI you cannot live without AI in this era. All the medical equipment, they are coming with the AI embedded solutions. All the vaccine inventions, they depend with the AI models. And also, AI is the way to go. Not only AI, but machine learning, virtual reality, blockchain, and the other emerging technologies. We need to bless them to make sure we tap the potential which are deposited in AI and emerging technologies to bring this world to make it a better place. Actually, there is one gap which African government and the other government, they need to play a part. Startup and Gen Zs, they are tech savvy. They move faster than the government move. Innovators, they move faster than the government move in such a way that when you have AI models, you need really to, when they create an AI models, the government need to be a regulator of these AI models in such a way that they need to measure the thresholds of these AI models, whether this threshold of this particular AI model is sufficient for human consumption, for safer any liability of these AI models, for which the potential they bring to human being, in such a way that if we need to know which is safer AI model and which is not safer AI model, so that we can allow it to go to the industry for practice. So the government, African government, they need to be capacitated at a level whereby they can be led to evaluate these AI models and vet them to see which one are safer and which one are not safer for human consumption.
Thank you very much, sir.
Thank you very much.